Hi, my name is Emma Hickson, and I chose to do research on major depressive disorder this year. I chose this topic because I feel like MDD is very relevant, not just in the field of psychiatry, but in various other medical fields, as patients' mental state has a very large impact on their physical state. And so I did a lot of research on it this year, and I'm going to be presenting some of the general and clinical features of MDD, as well as how to diagnose, treat, and prevent it. So, MDD is shown to affect about 10% of individuals worldwide. It's most common in women, but men can also definitely suffer from it too. There's a high variability in how people can present with MDD, but some common features are loss of interest in normal daily activities, changes in sleep, and feelings of inadequacy. Some other features might be people that have difficulty with focus, weight changes, and they might be more irritable, and they could have suicidal ideations. Of note, something that I found in my research is that people with MDD, there's a connection that's been found to those who have also experienced stressful events as children. So, what do we look for in a patient who's presenting in the clinic that has MDD? Well, the key place to start is getting a very thorough medical history, especially because the presentation of MDD can be so variable. And so you really want to obtain a thorough personal, social, and family history. Being sure to ask about the patient's personal relationships, as this can be one of the first things that's affected in a person who's suffering from MDD. Some secondary causes to make sure to have on your radar. Hypothyroidism can lead to depressive type symptoms, and so you'll want to do a screening TSH. Also, consider maybe doing your drug screen, as people who are abusing drugs can have symptoms similar in presentation to MDD. Also, a couple of very similar conditions within the field of psychiatry that can be confused with MDD is atypical depression, which is very similar, other than the fact that patients with atypical depression will have temporary episodes where their mood is improved. And so you don't want to rule out depression just based on that. And then also bipolar disorder, but that can be differentiated because people with bipolar disorder will also have manic or hypomanic episodes present in their history. So how do we diagnose MDD? One thing that I found from research is that early intervention plays a really important role in how people with MDD ultimately are able to recover, and how quickly and to what extent. And so it's really important to be familiar with these diagnostic criteria. The core components that must be present in diagnosis of MDD are depressed mood and anhedonia, so loss in interest in daily activities, basically. There also must be at least 5 of these other symptoms, which include sleep pattern changes, weight changes, psychomotor dysfunction, difficulty focusing, fatigue, guilt, and thoughts of suicide. A really useful screening tool for MDD is used in clinical practice is the PHQ-9. This is a 9-question screening document, and it's scored according to how often a given symptom is experienced. And then you sum up the question scores, and that will help determine the presence of MDD and also its severity. So, how do we treat MDD? The first line options established for MDD are SSRIs. These medications lead to increased levels of serotonin in the body, and thus decreased brain reactivity. improvement to critical thinking. They just have a lot of really positive hormonal effects that lead to mood improvement. It's important to note that SSRIs often take about 6 to 8 weeks to exert their maximal effect. And so you'll want to let patients know that so they don't expect immediate results. It's also important to let them know of some of the common side effects of SSRIs, which are variable depending on which one you choose. But one that is commonly seen that you might want to mention to them is the potential for sexual dysfunction after starting SSRIs. If SSRIs prove ineffective, and also cognitive behavioral therapy, which is first line option that is not a medication, but has shown to be really effective. But our second line treatments to either add or replace first line medications are either atypical depressants, or you can increase the dose of the SSRI they're already on. One of these atypical depressants is mirtazapine. This one can be used in people who are having difficulty sleeping, as it causes some sedation there. You just have to watch out for people gaining weight on it. Another option is bupropion. This one does not cause weight gain or sedation, but it can be really useful in people who don't have a history of seizure disorders or eating disorders, and who also may be interested in quitting smoking. A last line therapy is electroconvulsive therapy. This is often only really used in emergent settings, but it's shown to be really effective. And you just have to let patients know that they may have some initial memory loss, and that often kind of resolves itself over time. So how do we prevent MDD? So one of the biggest things is lifestyle modifications, things that will overall just improve a person's quality of life, and that can ultimately lead to prevention of MDD as well. Some examples include increasing activity and time spent outdoors, proper sleep habits, healthy diet. One thing that is a very practical step that patients can include into their daily habits is meditation. There's a lot of online resources for that, and it's very easy to learn even for just the average person. Another thing for people who have previously been diagnosed with MDD, it's important to emphasize compliance with their SSRI even after symptoms improve. MDD is very often recurrent. So once somebody recovers, they may relapse into it. And so medication compliance can help prevent that. For patients who are not really compliant with medication and you are concerned that they won't stick with it, another good option is mindfulness-based cognitive therapy. So that's about it for my presentation of MDD. Here are some references that I used in my research. And that's a wrap. Thanks for watching.